Hello, my name is Maester Teacher. Today we would be looking at some questions in the thoracic, as demand but one of our students. You can hit the comment section addressing where you need help. I'll be the questionnaire while myself, Mommy Gross, would be answering the questions with reason. Okay, let's start. Question number 1. The articular part of a rib tubercle articulates with which of the following structures? A. Body of the vertebra. B. Costal cartilage. C. Adjacent rib. D. Sternum. E. Transverse process. The answer is E. The tubercle has a smooth articular part for articulating with the corresponding transverse process of the vertebra and a rough non-articular part for attachment of the costotransverse ligament. Question number 2. Where is the groove for the subclavian artery located? A. Posterior to the scalene tubercle. B. On the clavicle. C. On the manubrium. D. At the sternal angle. E. At the angle of the first rib. The answer to that question is A. The surface of the first rib has two transversely directed shallow grooves, anterior and posterior to the scalene tubercle, for the subclavian vein and the subclavian artery respectively. Question number 3. The retromammary space is located between which of the following structures? A. Skin and the areola. B. Pectoralis major and minor. C. Breast and deep pectoral fossa. D. Suspensory ligament and the skin. E. Lactiferous sinus and the nipple. C. Between the breast and deep pectoral fossa is a loose connective tissue plane or potential space known as the retromammary space. Number 4. The high death rate associated with breast cancer is related to which of the following? A. Nerve supply. B. Blood supply. C. Venous drainage. D. Poor imaging techniques. E. Complex lymphatic drainage. The answer is E. Because the axillary lymph nodes are the most common site of metastasis from a breast cancer, enlargement of the palpable nodes in a woman suggests the possibility of breast cancer and may be key to early detection. However, the absence of enlarged axillary nodes is no guarantee that metastasis from a breast cancer has not occurred, because the malignant cells may have passed to other nodes, such as the infraclavicular and supraclavicular lymph nodes. Question number 5. Which of the following statements correctly apply to the internal thoracic artery? A. It runs posterior to the transversus thoracis muscle. B. It ends in the sixth intercostal space. C. It divides into the superior and inferior epigastric arteries. D. It runs posterior to the superior six ribs. E. It gives rise to the posterior intercostal arteries. B. After descending past the second costal cartilage, the internal thoracic artery runs anterior to the transversus thoracis muscle. It ends in the sixth intercostal space, where it divides into the superior epigastric and musculophrenic arteries. Number 6. Which of the following statements concerning the sternal angle is correct? A. It lies at the level of the intervertebral disc between T4-T5. B. It is flanked by the costal cartilage of the third pair of costal cartilages. C. It is crossed by the superior epigastric artery. D. It lies in the epigastric fossa. E. It is located 3 mm superior to the jugular notch. A. The sternal angle is located opposite the second pair of costal cartilages at the level of the fourth intervertebral disc between T4 and T5 vertebrae. Number 7. The pleural cavity contains which of the following? A. Lungs. B. Bronchi. C. Serous pleural fluid. D. Lymph nodes. E. Pulmonary arteries and veins. C. The pleural cavity, the potential space between the layers of pleura, contains a capillary layer of serous pleural fluid. It provides the lubrication and cohesion that keep the lung surface in contact with the thoracic wall. Question number 8. The parietal pleura consists of all of the following parts except A. Costal. B. Pericardial. C. Mediastinal. D. Diaphragmatic. E. Cervical. B. The parietal pleura includes costal, mediastinal, diaphragmatic, and cervical parts. Number 9. All of the following statements correctly apply to the right lung except A. The superior and oblique fissures divide it into 3 lobes. B. It is larger and heavier than the left lung. C. It is shorter and wider than the left lung. D. It contains a thin, tongue-like process called the lingula. E. It has 3 surfaces. D. The right lung has 3 lobes, the left 2. The right lung is larger and heavier than the left, but it is shorter and wider, because the right dome of the diaphragm is higher and the heart and pericardium bulge more to the left. The anterior margin of the right lung is relatively straight, whereas the margin of the left lung has a deep cardiac notch. The cardiac notch primarily indents the anteroinferior aspect of the superior lobe of the left lung. This often creates a thin, tongue-like process of the superior lobe, called the lingula. Question number 10. All of the following statements correctly apply to the left main bronchus except A. It is wider, shorter, and runs more vertically than the right main bronchus. B. It passes anterior to the esophagus. C. It passes anterior to the thoracic aorta. D. It contains C-shaped rings of hyaline cartilage. E. It arises at the level of the sternal angle. A. The right main bronchus is wider and shorter, running more vertically than the left main bronchus as it passes directly to the hilum of the lung. The left main bronchus passes inferolaterally, inferior to the arch of the aorta and anterior to the esophagus and thoracic aorta, to reach the hilum of the lung. Question 11. All of the following statements correctly apply to a bronchopulmonary segment except A. It is separated from adjacent segments by connective tissue septa. B. It is the largest subdivision of a lobe. C. It is not resectable. D. It is named according to the segmental bronchus supplying it. E. It is a pyramid-shaped segment of the lung, with its apex facing the lung root and its base at the pleural surface. C. A bronchopulmonary segment is a pyramid-shaped segment of the lung with its apex facing the lung root and its base at the pleural surface. It is the largest subdivision of a lobe and is separated from adjacent segments by connective tissue. It is surgically resectable. Question number 12. Which of the following structures is located in the middle mediastinum? A. Thoracic duct. B. Lungs. C. Esophagus. D. Heart. E. Azygous vein. D. The middle mediastinum contains the heart. Number 13. All of the following statements correctly apply to the right atrium except A. It receives blood from the superior and inferior vena cava and coronary sinus. B. It forms the right side of the heart. C. It contains the crista terminalis. D. It contains the limbus fossae ovalis. E. It contains trabeculae carnii. E. The right border of the heart is formed by the right atrium. It receives venous blood from the SVC, IVC, and coronary sinus. It contains both the crista terminalis and the limbus fossae ovalis. The interior of the ventricles contains irregular muscular elevations called trabeculae carnii. Second to the last for the day. Number 14. The interventricular septum contains which of the following structures? A. Anterior papillary muscle. B. Fossa ovalis. C. Sinus venerum. D. Sinoatrial node. E. Conus arteriosus. E. The interventricular septum is composed of membranous and muscular parts. The conus arteriosus leads into the pulmonary trunk. A thick muscular ridge, the supraventricular crest, separates the ridged muscular wall of the inflow part of the right ventricle from the smooth wall of the conus arteriosus or outflow part. Question number 15 and the last for the day. Which of the following structures is located in the posterior mediastinum? A. Lungs. B. Heart. C. Azygous vein. D. Superior vena cava. E. Right coronary artery. C. The posterior mediastinum contains the thoracic aorta, thoracic duct, azygous and hemiazygous veins, esophagus,